I'd like to welcome Mr. Vince Clark, Superintendent of Crittenden County Schools, to today's NewsTalk. Mr. Clark, we haven't had one of these discussions in quite some time, and that's been good news. Unfortunately, not real. Governor has issued an edict once again to close schools and restaurants, and put restrictions on a number of other things that we tend to enjoy in our lives, church and family, and here with Thanksgiving coming on. I know we've been in a good place, I felt like, as a community for many months, but right now I'm starting to sense some fear because cases rise not only here in Crittenden County but across the state and nationwide, up 75%, I heard this morning. So it's a difficult time, so I'll let you just explain what we can expect out of the schools. This will be the last day, today, Friday, last day of in-person class until the way they're saying after Christmas.
Well, possibly, Chris, and I appreciate you having me on today to talk about this for folks. I think most folks kind of know all the details. Order that was issued on Wednesday, but before we get into that, I want to take a moment and just say how much I appreciate and how proud I am of our students and our staff in Crittenden County Schools and our community as well. You mentioned today is the last day for in-person school until possibly December the 7th, when elementary kids could come back if we're out of the red. Otherwise, we may be looking at January the 4th. But, we have had 55 days of in-person learning since August the 25th. And I'm not aware of any school district in Western Kentucky that has achieved that at this point. And it really goes back to, just the willingness, the compliance, the cooperation of our students and staff to make this happen. And, when we compare even our current numbers, and it is, in our state, positivity rate is knocking on 10%. We've looked at hospital data, hospitalizations are up, ICU beds are up. It is concerning, but even when we compare our numbers now during this red storm to our neighbors, that have been on virtual, their numbers are still double and triple ours at this time. So it's it is concerning, that we're in this, and that we know that beds are becoming limited at some point. Ventilators may be limited at some point as well. And I'm sure that's kind of what we're trying. I hope by sacrificing the next 17 days of in-person learning that we're able to see some improvement on those numbers. We're going to watch that very carefully. We are advocating right now in Frankfort, and anybody that heard Board Chair Chris Cook last night feels very strongly about this, as does our board, about letting it be a local decision. We have demonstrated that we're able to have in-person learning, and we've followed the guidelines, and our folks have done a good job. And we have spent the last 2 days working on our remote learning plan moving forward, and we'll make it the best that we can. But everybody knows that nothing replaces that in-person, in-class learning opportunity with a caring certified teacher in that classroom. And our 70% of our kids have demonstrated they want to be in school, and they have worked hard to do that, and we're going to work hard to get them back in school. So moving forward right now, preschool was not part of the executive order. That's a local decision, and our decision is we're going to have preschool moving forward. Now, Monday and Tuesday, it will be virtual. It will be remote, but we will come back on November the 30th after Thanksgiving, and we will have in-person preschool.
Just for preschool. Now,
just for preschool.
In their same venue, their same location. You won't move them anywhere else.
No. Yeah.
And let me pause for just a moment, though. I want to say that this is National Diabetes Month. I know we're talking about this coronavirus and how important that is and what it's weighing on our society now. But also diabetes is a very important disease. And this is National Diabetes Month. And the Pennyroyal Area Health District would like for you to know that it has a lot of resources available for children, for student school-age children. We've posted on our Facebook page and on our all of our social media, Snapchat, a video that they have put out, and they would also like Kelly Dawes, who is the diabetes specialist for the area here, and Allie Perriman, who is a certified dietitian, are available to talk to you as a parent or as a child with diabetes and give you some tips on how to manage that. And all the more important with these children at home, not on a good routine with a diet, Mr. Clark, and I know that's something that weighs heavy on you as these kids go home for the holidays for a number of days. And I assume that we will try to reinstate that feeding program.
We are, and that plan in detail will come out later today. Okay. But I did get confirmation the day before I left the office that they are working on that plan. It's really going to resemble our plan that we had in May, where we will have, I think, 9 buses that will go to different locations in our county, which will cover most of our routes. And along those routes, we will have a few stops, sites that we'll be delivering lunches. That will start the week of November the 30th. Next week, Monday, because the executive order came out after our food order this week, so we weren't actually prepared for next week. But we will be able to do drive-through lunches at the elementary school on Monday for folks.
And that's the same drive around behind the school and pick those up. Do you call, text to get a meal? Or
that will be communicated out today. I think on Monday. I think it will just be open on Monday for folks that want to drive through. Stay tuned
to the social media of the school districts as well as the CrittendenPress, and we try to relay all those messages to you on our website as well as our other platforms. Mr. Clark, I know of great concern is the children not being in school, but the bright spot in this is that we may be able to bring some of them back a little earlier than after Christmas. I want you to explain that, how there's a window of opportunity to get the elementary school back in, and why that's so important, maybe because of daycare and just also the way they learn. So
yeah, true. Yeah. So we mentioned preschool, so that that's a good hopeful sign for folks, and I know that will help families out, as working families especially, out as well. We will have an opportunity to bring elementary kids back on December the 7th if our county on the Thursday before. So we'll be looking at that incidence rate map to see what our color is and how we're doing on numbers.
So that'll be on December 3rd, wherever we're at on December 3rd.
On December 3rd, I think like at 5 o'clock is when that comes out. And if we're not red, then we can bring elementary kids back on that Monday, December the 7th. So we're hopeful for that.
And then do you have to stay out of the red, or that's just checked each Thursday? Is that how that works?
It's supposed to be checked each Thursday.
Okay.
And then we will make a decision. And of course, what we've done previously, is looked at our quarantines in our schools. We've looked at positives that we've had, how are the numbers in our community and things like that. But, the way we understand it, this still falls under the executive order. So we are more restricted, during this time up through January the 4th. We're a little more boxed in.
Yeah.
Right now than we were back in August and moving forward. But we're hopeful to get those kids back into the building. And I've had a lot of questions about, well, why is that for elementary? But you can do that for elementary, but not middle and high school. And I think a lot of it goes back to child care. Child care, the two big challenges Crittenden County has, and our state has, and our nation has, is during these remote learning opportunities is child care and Wi-Fi access. But for elementary kids, they do need to be supervised. And that can best happen, at school. Middle and high school kids have a little more flexibility with their supervision. So I think that, the opportunity to remote, and I can't, I'm just speculating really. I mean, I can't speak for the governor, or the Department of Public Health on why that is. I can only say that's how I've responded to that.
Certainly makes a lot of sense. I want to remind everybody, we do have a COVID screen. I don't know if you can see that here. If you think, well, they're awful close, and we are, but we do have this protective screen up to make sure that we're not spreading this disease by any measure. I want to say, too, you mentioned Wi-Fi accessibility around the community. Since the spring, we know that some of the volunteer fire, I think all the volunteer fire departments now have a hotspot. This week it was announced that Kenergy has a hotspot, and there are a number of others, the library. Are there any other new ones that we have the availability where people, if in your community, drive up to, download your homework, upload your homework, whatever you need to do, and it's close?
Yeah, I mean, there's just several, and that's been communicated out, on our social media as well. The ones that come to mind, of course, you mentioned Kenergy. Kentucky Farm Bureau is something that they've done statewide. It's, to get behind public education. So they have that. McDonald's has been one, the public library. We have boosted our school parking lots as well. So you can get a better signal in our parking lots as well. As a result of this, the, fire departments are pretty good right now. And we also have one hotspot that we can put in a board vehicle or on a school bus as we deliver these lunches, starting on November the 30th, where as kids get their lunch and their breakfast, then they can hit a Wi-Fi signal there. So we're going to see where the biggest need is for that as well, and then advertise which bus that's going to be on from day to day.
Mm-hmm. I want to remind everybody that this is National Diabetes Month, and I know the coronavirus is what is on our mind today and will be for many days to come, and it's what's affecting our lives, but also diabetes, a very pervasive problem among students, or among school-age children. And right now, there's a lot of resources available from your local health department, and you can call out at the Crittenden County Health Department or the Pennyroyal Health Department down in Hopkinsville, and you can get all kinds of information about how to manage your diabetes. Look at the CrittendenPress website. We have a video posted there, and we're posting it across our social media. So pay attention to that if it's something that affects your family. It's very important. Mr. Clark, in the coming days and weeks, I assume we're going to see a big change in how these kids are educated, obviously. But it's something we're accustomed to. We've done it. We started it a couple of years ago, maybe 3 now. I don't know, time gets away from me with the NTI, the non-traditional instruction. So they're becoming accustomed to it, and it's a tough time for them. We know that. And are you observing that this is wearing on them? Is it wearing on teachers? I assume that it is, all of this.
It is. It really is, and we've talked, extensively about that this week. The kind of the wear and the tear and the grind, for teachers and support staff, through all this, the impact on students. With the protocols and just doing things differently, on parents. That are trying to work 40 or 50 hours a week, but then make sure that your kids are staying caught up with their lessons, and then all the other things that go, along with that. So, it is a lot. And then, boom, this week we've got all these restrictions now that's been handed down by Frankfurt from the governor, an executive order to protect public health, and then, school is going to transition as a result of that to remote learning. That's a lot of change, and already a stressful kind of situation as folks head into the Thanksgiving holidays. Trying to be careful about who's around the table, what you can and can't do. So we're not contributing to the issue. So yeah, it is. I mean, it really is. But I'll say one thing: our teachers, they are resilient. They are amazing, incredible individuals. They have such big hearts for kids. I know we had a board meeting at the high school last night, and before I could get home after the board meeting, pictures, because she was going back to the elementary school to finish up some work, and found that several teachers were still at the elementary school decorating their rooms, making sure that that today just wasn't about just Thanksgiving, but also the Christmas holiday as well, right, too. So they really worked hard to provide that cheer and joy for kids. The kids noticed it today with the lights and the decorations and things like that. But to have that, before they went home today.
Across social media, at the water cooler, at the diners, you're starting to hear some criticism about sports and how some sports are being delayed, some sports are on. And I think there's a defining edge there that we can point. Activities are really being tightened down on. Basketball season, which was supposed to start on Monday for high school students, is now pushed to after Christmas, January 4th, I think is the first day. Meanwhile, football playoffs that have been getting ready to kick up here start tonight at some venues is going to be allowed to proceed. You want to speak to that and how what's going to happen as far as what you foresee happening and why maybe that these being outdoor, it's just a little bit different.
It is different. I mean, and it's
and this isn't a local decision. This is a decision statewide.
It is. It comes from Frankfort. Kentucky High School Athletic Association, makes the recommendations, and I think they make sense. If we think back to football, when they started, they were delayed as well, and there was some restrictions with them, and it is outside, and I think some of the research that shows us that it's safer, for outside activities. The indoor activities, I think, plays a role in the kind of the sharing of the virus. That's why the recommendation is at 15% capacity in those indoor venues when we get started on January the 4th. So they're going to be delayed, but from what I understand, they'll be able to play or intend to play, January, February. And then at some time in March, we'll start the district and regional tournaments. And we're in a pandemic, so we may not get the full season in, just like we didn't get the full season in football as well. But there's also an effort to protect that spring season as well, the baseball, softball, track, because that was sacrificed last year. So to try to wrap basketball up by March, so that baseball, softball, and track will have their opportunities to participate this year. So, and then for basketball, I think the recommendation for that could start on December the 14th, so that they're being acclimated for their season on January the 4th. And there's also an opportunity to do some individual workouts with restrictions in between now and then. For basketball. So we're exploring all those things because we know is that it's important for the emotional health of these kids as well. Sure. They're programmed to compete. Physical activity is an important part of their day, and when you replace that with nothing, then you have depression and anxiety and emotional issues. So it's all of this. And, one of the articles I wrote for the press was striking a balance between risk and benefit. And that's what we're doing every day, whether it's in-person learning, virtual learning, remote learning, football season, basketball, spring sports, transporting kids on school buses, everything that we do. I just kind of went through a list of the things that feeding kids. You have one executive order, but there's about 50 things that come along with that.
Yeah. Well, I've said from the very beginning, you have probably the most difficult job in the community. Superintendents across the state have, and it's been a roller coaster ride. And we're back. We've been on the summit, and now we're back down. I guess on the low ground again, trying to get back. So we will do what the governor has ordered, and we will send the kids home. It doesn't appear that schools have been a big factor in the spread, but I think this is obviously just a reaction to some rising numbers that indeed is starting to cause fear. That I'm seeing more fear right now from people, more concern than I have before. I think the disease is starting to touch more lives.
Yeah.
And I think, therefore, the closer it comes to your home, the more you see that this isn't just something that affects people who are infirm, ailing, and maybe in very poor health anyway. It's affecting people who are relatively healthy, that would have no other reason to be in the hospital unless they were stricken by the coronavirus. So we lost our former emergency room doctor, Dr. Russo, passed away this week from complications. And I know a man very near and dear to our hearts, Al Starnes, former football coach, has been struggling with this. I've talked to Al several times, and he's still having some effects of it. And I think some of those cases are testimony to how serious this is. And
and it's strange how it impacts people differently. Yeah.
Sure.
Mm-hmm. Yeah.
Sure. So good luck, Mr. Clark, in keeping the logistics of all this in place. I know it's a very difficult chore. Your team does a great job. Our community is so proud of the fact that we did get that many days of in-person class, in school education. I think it's a testimony to the hard work and the fact that we live a little different lifestyle here than maybe in some areas. So thanks for coming on again today.
Well, thank you for having me.
Any closing words you have?
No, you mentioned, I mean, our leadership team in our district, and, you know, our folks at central office, our principals, our board, you know, our teachers, you know, everybody pitch in on this to make it happen. And, you know, we've worked hard to assemble a team that are problem solvers, that are critical thinkers and good communicators. And we don't always get it right. I mean, we don't. But we do try to make thoughtful decisions and try to communicate it out and let folks know. And, you know, our community has been great in supporting us. I couldn't tell you how many times I've heard people say, I wouldn't have your job. You know, I wouldn't have your job. But, you know, I just look at it, I'm thankful that I'm where I'm at. Yeah. I really am. It's heavy a lot of times. But I'm thankful for the team that we have that go to work every day to do what's best for kids.
Well, we're thankful you're where you're at, and thankful they are where they are at, because you've done a yeoman's job through all this. And,
appreciate it.
Do want to also remind you that November is National Diabetes Month, and childhood diabetes is a very serious issue, and it's very manageable. And if you would like to find some tips about how to manage diabetes, go online to the CrittendenPress online, to any of our social media, Snapchat. We have the video posted there, and you can see some tips how to manage childhood diabetes. And then also, if you have more questions, call your local health department. This message has been brought to you by the Penny Royal Area Health District. Thank you, Mr. Clark.
Thank you.